Đang ngồi chờ bác sĩ kêu vô khám lại lần cuối trước khi vào phòng bắn laser mắt của Elvis.
That's a numbing drop. Yep. Yes. Yep. Let me just go. So you can wear them for now. Sometimes it's easier to hear when you can see. And so I'm gonna, write some instructions right on the box, but I'm gonna also give you a cheat sheet with instructions, and of course I'm gonna verbally go over it now, and it's in the pamphlet that you read already.
Mm-hmm.
So these two particular ones we'll just save for later.
Okay.
You're not going to use them now, and I'll tell you when you start to need them. And so these 3 drops, they're all 4 times a day.
4 times a day.
Breakfast, lunch, dinner, before bed. Now today's different because it's afternoon, so just do dinner and bedtime today. Yep. And then tomorrow the full 4 times. Shake them really good. 1 drop, 1 drop. Wait about 5 minutes. Shake it really good. Put in the other one. Shake it really good. Put in the other one. It doesn't matter which is first. Just give them 5 minutes in between. Now the difference with the 3 of them is this one in the taller box. It's only through Saturday. So you'll use it today, all of Friday, all of Saturday, and then no more.
Okay.
And then you'll just use these. Okay.
Okay. So that one's for Thursday, Friday, Saturday, right?
Correct. I said through Saturday.
Okay.
And it'll be on the paperwork as well. It'll have a gray cap.
Oh yeah.
This one has a brown beige cap. This one has a pink cap. The teardrops are every 2 hours while you're awake for 1 month.
Okay.
And then 4 times a day the second month. More's okay, but at a minimum that amount. Now just don't use these too soon before or after, because I don't want you to wash them out. I don't want you to dilute them. So like a half hour before or after is just fine. You're going to have clear shields that we tape on the top. The tape acts like a hinge. Just lift it up and get the drops in. These stay on all day today, and then at bedtime for a week. Okay. At bedtime for a week, I want tape on the top, I want tape on the bottom, and we'll give you tape today. This way you don't rub them, bump them by accident. In the morning, it's possible the lashes might be stuck together. It's just all the drops drying up around the lashes. I don't think that will, but if it does, you can just touch the lids on the bony part and separate it. Again, I don't think that'll happen. You can shower tomorrow morning. Just keep your eyes closed when the water's hitting in the face. We do that anyway. Washing your face, just totally avoid the eyes for like 2-3 weeks. Dab them dry, don't rub them dry. There's no swimming, there's no saunas, there's no hot tubs for 2 weeks, and there's no eye rubbing for a month. Eye rubbing is a disaster. Don't rub them. A close second, something causing extra force, extra friction on the front of them. Like I said in the shower, actually scrap that. That doesn't apply for this. So You can shower tomorrow morning. Again, keep your eyes closed. Dab them dry, don't rub them dry. And no eye rubbing for a month. So eye rubbing is really bad, so don't rub them. Let's see. Let me give you another drop. So look where you at. So, yeah, go ahead and dabble them. Putting in your own drops, just touch the lid at the cheekbone. Put in the drops, gentle blink, you're good. Don't go to the upper lid to get it out of the way, and be careful not to bump the eye with the dropper. Tip, the Valium can make you sleepy. Not right now maybe, but when you get home it's easy to sleep. I would just sleep. And if you feel like you are, put tape along the bottom of the shields. Don't plow your head in the pillow and just sleep away. Even if you're sleeping at dinner time when I want these to go in, just sleep, put them in when you wake up, okay? You'll be laying underneath the laser. There's 4 lights shining down on you. He'll dim them, he'll brighten them. In the middle is a green blinking light. That's what we want you looking at. There's times it gets fuzzy. There's times you can't see it at all. But when you see it, that's where you'll look. There's noises, beeping, buzzing, ticking, tapping, music playing. Starts on the right, he'll go to the left. Always seems like more on the left, but it's not. Remember, 0 pain with this procedure. During the laser, colored lights can sort of dance around, and some people get a burning smell, some people don't. Nothing's burning. Remember with this procedure, the first day or 2 or 3, the eyes can be a little extra burny and scratchy and teary. Burny, scratchy, teary, just put in more tears, okay? Some people, you got 2 bottles, some people will stick a bottle in the refrigerator, and sometimes that cool drop can feel nice. A deeper soreness, light sensitivity, if you can take Tylenol, if you can take Advil, do that. In fact, Tylenol and Advil control pain differently, and there is an additive effect for pain control. So 2 Tylenol, 2 Advil, 3 times a day is very strong. Above and beyond that, we're giving you a prescription for generic Vicodin, narcotic painkiller. Some people don't do well. They get nauseous, they vomit, they get constipated. In the end, it didn't help them at all. For most people, a little sleepy, and it helps with the pain, okay? I need to do a little more, or actually, I don't, but do you need to use the bathroom?
No.
Okay. So it's Dr. Warren, he's the one that's gonna do, that'll go on your head. He's the one that's gonna, I can take that.
Yeah.
He's gonna do the procedure. He'll come in here shortly. He'll look at your eyes with the microscope. He'll talk with you, of course. Stick a foot out for me. And then we'll get you in there pretty quick, about 15 minutes. A little squeezy ball, something to hold on to. This is that Vicodin prescription, so that's just going to go in the bag. And just bring your bag with all the drops for the first like 3 or 4 follow-ups.
All right.
If you want to just put that all in there. Right, so I'll just have you guys wait here, and Dr. Warren will be in shortly.
làm trong phòng này.
Doing the surgery. It's good to meet you.
Good to meet you too.
So I wanted a chance to talk a little bit. I want to look also and see how your eyes look before the procedure. I want to add an ink mark that I can use to be sure of the alignment, because you have a lot of astigmatism. So the astigmatism has a direction to it. And I want to make sure under the microscope that everything is lined up perfectly. So, did Dr. Wakowiak already put some drops in?
Yeah.
Yeah, so I'm going to add just dots with a pen.
Okay.
A magic marker, just to add a couple dots so that I can see where 3 and 9 o'clock, where those positions are on the eye. When we lie down, oftentimes the eye will rotate. So when we're sitting up or standing up, the eyes are straight. But
When we lay down, it's
yeah, they don't always stay straight, and so I don't want that to throw off our astigmatism correction.
all right.
Yeah. So, and then I'll talk you through the procedure. It's really quick and painless. Lots of bright lights, lots of drops, lid holder, right, to hold the eyelid open. I've got a brush. It's like an electric toothbrush. It spins, so you can feel a little bit of vibration with that. I use that to polish the epithelium, get rid of the cells off the surface.
Okay.
Then we do the laser. You can hear the laser, but you can't feel it. And then after the laser, there's a couple of treatments that I apply that help with the recovery. So I apply ice for 30 seconds, and then there's a medication called mitomycin that I apply for 20 seconds.
What does the mitomycin?
It's anti-scarring.
Anti-scarring. Okay.
Yeah. So it reduces proliferation of fibroblasts. So it has an anti-scarring effect. And then we do a cold rinse. So cold rinse, then contact lens. The contact lens stays on the eye until the new surface
Reforms.
Yeah, which usually takes about 4 or 5 days. So tomorrow you'll have a checkup, and then the contact lenses usually come out around Tuesday.
Tuesday. Okay.
Yeah. Do you have an appointment on Tuesday?
I believe so.
Yeah. So that's when we think you'll be ready to have the contact lenses removed.
Okay.
And then it takes about anywhere from 6 to 12 weeks to really completely heal. So it does take time, but it just keeps getting better and better and better as it's...
It just goes on. It just goes on.
Because there's like a remodeling, smoothing process, right? Just imagine like if you scraped your skin.
Yeah.
Right? After a week, it doesn't hurt anymore, it feels pretty good, but it's not completely healed. Right? It takes time to completely heal. So just be patient with it, but obviously we expect to get a great result. How are the two of you doing?
Good.
Nervous?
I used to get my eyes surgery before.
Oh, you already had it done?
Yes.
But not from us?
No, 13 years ago. Yeah.
Okay. So.
I did it in my country, Vietnam.
Okay, good. Yeah, and no problems?
No.
Good. Yeah. So, all right, let me take a look. I want to add the ink mark, the astigmatism. And astigmatism is linked, by the way, to eye rubbing. Okay. So I always try to remind my patients with astigmatism, don't rub your eyes. Now, of course, after the surgery, you're not supposed to rub your eyes. Yeah. But even after it's done healing, don't rub your eyes because it can bring astigmatism back.
Okay.
And I don't know if you're somebody who rubs your eyes or not, but that's been shown to be...
When I was young, yeah.
But not recently?
No.
Okay. Yeah, some people rub their eyes a lot, and it brings the astigmatism back after Lasik. If people start getting into that habit. Okay. Yeah, so the surface looks normal. So that's good. Let's take a look over here. Yeah, so the cornea looks good in both eyes. Alright, so for the ink mark, what I want you to do is to push your forehead against the front here. I'm going to bring it down so you can kind of lean a little. And then look straight ahead with both eyes Yeah, both eyes wide open. That's good. And then blink. So that's one dot. I'm gonna add a matching dot. Keep looking straight ahead at me. Good. Let's see if those match. Good. And then blink your eyes. All right. Yeah, eyes wide open. These numbing drops do a great job of numbing up the surface, but not your eyelid. So your eyelid will still try to defend you. All right, blink your eyes. Good. All right, let me see if I can get a matching dot over here. All right, and then blink. All right. And then look towards my ear. I'm just seeing what happens with these marks as your eye moves right and left. Okay, now look straight towards me. Just gonna add a little bit of ink here. All right, now we got a good match there. All right. So I want to make sure that as you move your eyes around, that ink mark stays. Here, bring your chin down a little bit. And then look towards my finger. Good. Yeah. So we try to get the mark at 3 o'clock and 9 o'clock, right? So it's straight across. So we don't get fooled by any rotation there. And then during the procedure, I'll be talking to you. So I'll talk to you about the drops, and there's a lid holder, and that polishing tool. I'll talk to you so you're not surprised by what you're experiencing. All right, we're doing your treatment on the surface because we think it's safer for you.
Yes.
Was yours PRK or was it Lasik? Do you know?
Lasik.
So with Lasik, we make a flap.
They
We lift
open
up
the
the
flap.
flap.
Yep,
Yeah.
they lift it up.
Right.
And I don't know what they're doing, but
Same laser. So it's whether we do the laser under the flap or on top, it's the same treatment. But with the Lasik flap, you get faster healing. So that's the advantage. But it requires treating deeper into the cornea because the flap takes about 20% of the top of the cornea. So if it's a bigger treatment, if there's a lot of astigmatism, it's safer to do the treatment on the surface so you keep the thickness of the cornea more intact under the treatment. So that's the reason we're recommending with you that we don't do the Lasik flap because we just think it's going to be treating too deep into your cornea.
Mm-hmm.
So, but it's the same laser, same outcome. Yeah. Do any of you have questions?
No.
All right. So I'm gonna see if the technicians are ready, because if they're ready, then we can get started.
All right.
And then I'll just talk you through it.
Yep.
Okay. If you have questions that come up in the laser room, it's okay to talk. So if you want to ask a question or you want to say something, it's fine to speak up.
Okay.
Okay.
Yes, sir.
All right.
Yes.
And then there are 2 chairs right outside the room. You're welcome to watch.
Yes.
If you want to record it, you can record it.
Oh, okay.
Hello.
There's a screen that shows what I'm seeing.
Okay.
So you can make a recording, it's fine.
All right.
All right, how you feeling, Elvis?
He's ready. So I marked him for the
Alright.
astigmatism.
Okay. All right, perfect. So you're gonna follow me, Dad. If you're gonna watch.
Yes.
Are you Mom?
Yes.
Yes. All right. You guys can come with me. You guys can watch. I'm gonna go right this way.
Giờ đi vô phòng mổ nha.
Okay, so Elvis, you're gonna come in here with me. But you guys can have a seat right over here.
Okay.
And be able to see the whole thing right on this screen here. You can leave your glasses out here because you won't need those anymore.
Say goodbye to your glasses.
There you go. All right, you're gonna come right in. Hi, chị quay trên tivi này thôi mà.
Đâu nhìn này quay ngoài cũng được mà.
going.
Xong con rồi đó. Như vào bóng, đánh bóng xe vậy. Trước khi đánh lấy cái bàn chải đánh trước cho nó...
Này ổng gắn đằng viên với gắn đằng viên. Nó còn bóc ra nó chà 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 nữa. Bóc tay ổng luôn.
Tới con mắt thứ hai nè. Xong con rồi. Bảy phút một con. Nào đâu đâu nó chế vào bóng vô, bắt đầu lấy cái chải chà nè, coi kỹ đi.
Ẩm cái dòng nó vô để nó nhìn
Ừ, đánh bóng con mắt lại. Đó, bắt đầu nó chà chà nè, thấy không? Đó, lấy bàn chải nó chà con mắt nó, thấy không?
nó sẽ làm món kia với chà.
Nó bóp.
Đâu
Đó, chét vào bóng rồi đó. giờ mắt nó đừng nóng. Đâu, sáng lên liền không? Mắt có sáng.
Cái chuyện này chỉ được nghe tivi.
Hả?
Nói chỉ cho cần được nghe tivi thôi, khỏi chơi game luôn.
Xong 2 con. 14 phút.
Mấy thuốc đó ngàn quý. Mình đây 7 phút nữa thì 1.500. Làm sệt đấy.
I personally, we have it upstairs, but I'm not there.
Thấy đường đi không?
Không.
Còn thuốc mà. Thank you.
He did great. Everything went perfectly. No problems. So we're gonna wait, have him wait maybe 5 or 10 minutes just to rest. Take one more look, make sure it looks good, and then we'll let you go home.
Okay.
All right.
Thank you, doctor.
Was it interesting?
Yes.
All right. Very good.
Yeah, the procedure compared to me.
Yeah, but same laser, same idea.
Same methods, just that
Right.
the different procedure.
Correct. Yeah, different techniques. All right. Rest here for a few minutes. We'll be back to check on you. Okay?
Yeah. Không bóc gì đâu. Thôi nè. Làm gì không làm gì?
Rồi vật có nghe khác không?
Hả?
You smell anything?
No.
No? How does it feel? It hurts?
No.
Tickling?
Felt weird.
Feel weird? Like what? Can you...
I got it in my eye. Trời ơi, xịn mấy nước ngon.
Cái vô lỗ tai? Cái vô lỗ tai?
Xịn nước bình thường. Nước bình thường uống.
You see it? Cái đây nè.
Chị nào
Cái.
mới cho nó đi cầm kiếm mà nhìn gì. Trời ơi, có camera đây nè. Đã bắt chợ coi mà. Nhưng đâu cái nữa. Đợi điện thoại quen rồi. Dạ.
Về nhà nhỏ luôn.
Dạ. Còn nhiều cái con. Giờ cách ra nè.
Đâu? Ăn đâu? Đây.
Good afternoon, sir. Just so you're aware, Costco is running a special. The Emperor